This video series will look at the Counterpoint project tools, and the PowerPoint presentation is entitled Tools to Enhance Practice. The Counterpoint tools were developed by the Canadian Centre for Elder Law with funding through the federal government's HRSDC program. And again, the Canadian Centre for Elder Law is a national nonprofit organization that looks at legal research, law reform, and so on. And the National Initiative for Care of the Elderly is a national center of excellence, and it develops tools and knowledge mobilization materials, more than 2,000 members, and all of the tools are evidence-based. The Counterpoint tools are now being used by the NICE network and should be released shortly, but the links that I've given you are to the original tools at the Canadian Centre for Elder Law. I'll start with a quick recap. When we're thinking about these things, we're thinking about them as social movements and understanding that not everyone's going to be thinking about them in the same way at the same time. So I always think that patience is a virtue in this regard, and that social movements have ideas that expand and contract and flow. And so as you are moving forward looking at the intersection of health law and aging, I think it's helpful to look at it in a broad social context. And I've put some slides reminding us that I think we're about 30 years behind women's rights and about 20 years behind disability rights and maybe about 10 years behind environmental rights. When we're looking at the development of laws through issues of aging, particularly looking at how they intersect with health, I have put a small path about how our thinking has evolved. And we are really in the 2010s, and as the 2010s are looking at embedding issues of elder rights or health law or elder law into policies and practices, government strategies and hospital strategies and so forth. So we're at a level where people are looking at a systems-wide level. How do we make sure that we know the law, know our obligations, but also are looking at doing it in a way that promotes elder rights more broadly? A quick recap: when we're looking at future decisions, if you're a capable adult, you're the one that's supposed to be deciding. If you're an incapable adult, someone else decides, and in the case of someone else deciding, it will either be a court-appointed guardian, more likely it will be a power of attorney for, in this case, personal care, could be finance if we were looking at finance, and then there's the default list that we have, and we dealt with that earlier in the lecture series. When we're thinking about capacity, we are thinking about it on a continuum. People are more and less capable. They're not completely incapable or completely capable. We think of them as being more and less capable of making a particular legal decision at hand. And when we look at vulnerability, again, we're looking at people being more and less vulnerable. You may recall that we talked about Mary and Indira, and that the context, the culture, the continuity, and the capacity need to be considered when they're doing it. So that's our little quick recap. Given that context, the Counterpoint tools were developed. And the project was motivated to help healthcare providers look at difficult questions and ethical dilemmas in practice, and look at how can knowledge of the law support those practice. So real cases were considered, legal cases with health issues, both in the community and social service sectors, and we developed some tools that would assist them. The key questions and dilemmas that we looked at were: what are my obligations to respond to abuse and neglect, and what confidentiality issues applies? And we looked at those in earlier weeks. But also, how can I respond that makes sure that we are supporting independence and rights to live at risk, and looking at how mental capacity affects the entire scenario. And then how can we support older adults more broadly? So looking at some of the resources that we've developed to enhance practice, and these are just snapshots of the slides. I have put the link to all of the tools on your Blackboard materials. Here's an example of the summaries looking at abuse and neglect in each area, looking at who's supposed to do what and what the laws are to regulate here. And I've put up the ones on Saskatchewan, Manitoba, and Ontario. Again, noting that the obligations are different in different jurisdictions, and you can see here quite clearly who has to respond and what the laws are that affect. We've already put up the confidential patient and client information brochure in last week, and we've discussed that the easiest way to comply with laws is to get consent. But you can see here an example of the patient-client information brochures that we've developed. On mental capacity and consent, again, we have a set of tools looking at who gets to make the decisions in what context, and understanding that medical diagnoses are not the determinant of a person's mental capacity, and that consent is required in all cases. And you can see here an example of the brochure that we have. We created a number of fact sheets looking at obligations and looking at different specific groups: doctors, nurses, administrators, personal support workers, etc. And here's an example of a fact sheet for nurses. You'll see here as well that there are indicators of abuse screens, caregiver abuse screens, the easy tools, and the in-hand tools. Those are all available from the NICE network, and I'll provide you with that link as well. The charting tool is the one I would like us to use today, and it's a two-sided sheet, and it allows folks to use this tool as a snapshot. It identifies existing assessment tools, and it can be put into the patient and client form. So you can see here in the charting sheet, it gives you an opportunity to look at resources up above and fill in some of the tick box information along with a summary. The idea of using these charting sheets is to allow organizations, groups, and professionals to ask the same questions and to provide a snapshot. So remember how we looked at Indira and Mary, how Mary's situation had changed in that her abuse had increased and her risk and vulnerability had also increased. And we had Indira, who was originally quite safe in a long-term care facility, become quite unsafe. If these questions have been asked of those two women at different times, you would have different answers, and that would allow people who are supporting them to provide a good snapshot and tell each other, whether it's across emergency support, whether it's across the medical profession, whether it's across social work, or even community agencies. We know that the right questions are being asked. There are guidelines for improving practices that I would recommend that you consider using, and you'll see those guidelines, and I've put the information up there. There are also some video panel discussions that are available, and they are joint roundtable conversations looking at social work, medicine, nursing, administration, and looking at those. So there's a number of videos involved with those. That's a quick overview of the Counterpoint tools. I have provided you with the links of all of those tools, and we'll be using the charting sheet. Thank you.